Prostatitis and BPH are two conditions that can cause urinary problems in men. While prostatitis is an inflammation of the prostate gland, BPH is an enlargement of the prostate gland. These two health conditions are common in men over the age of 50. While the symptoms of prostatitis and BPH can be similar, there are some key differences. We shall try to point out the differences between these two health conditions. Let's start with prostatitis. What is prostatitis? The term prostatitis refers to inflammation of the tissue of the prostate gland. It can be caused by an infection or happen in the absence of one. The inflammation can be caused by bacteria, viruses, or other microorganisms. It can also be caused by a physical injury or stress. Symptoms of prostatitis can include pain, burning or itching during urination, and pain or discomfort in the pelvic area. Bacterial prostatitis is the most common type of prostatitis and can be treated with antibiotics. It could be acute or chronic. Acute bacterial prostatitis is an infection of the prostate due to bacteria. Symptoms can come on quickly and include fever, chills, urinary changes, ejaculatory pain, and pain in the pelvis or nearby zones. Treatment with antibiotics often leads to quick relief. Chronic bacterial prostatitis, on the other hand, occurs when bacteria become trapped in the prostate gland, causing recurrent UTIs that are difficult to treat. Non-bacterial prostatitis is the least common type, and it usually doesn't respond to antibiotics. Some cases of prostatitis will go away on their own, but if the symptoms remain, further treatment is usually needed. Now, what is BPH? BPH stands for benign prostatic hyperplasia. Benign prostatic hyperplasia, BPH, also called prostate enlargement, is a non-cancerous increase in the size of the prostate gland. Symptoms may include frequent urination, trouble starting to urinate, weak stream, an inability to urinate, or loss of bladder control. It's a common condition that affects men as they age. Men with BPH may also need to urinate more often, especially at night. The primary cause of BPH is unknown, but it is likely related to hormonal changes that happen with age. BPH is not linked to prostate cancer, and it's not life-threatening. However, if left untreated, it can lead to more serious problems, such as urinary retention and bladder damage. So what is the major difference between prostatitis and BPH? 1. Prostatitis is an inflammation of the prostate gland, while BPH is an enlargement of the prostate gland. 2. Prostatitis is usually associated with pain and inflammation, while BPH is not in most cases. So, how can you tell if your symptoms are caused by prostatitis or BPH? The best way to differentiate your symptoms is through a medical examination or test. Some of the tests include a digital rectal exam, a prostate-specific antigen (PSA) test, urinalysis, blood tests, an ultrasound, an MRI, or a CT scan of the prostate. Can prostatitis cause BPH? Yes, it can. Studies have shown that men with chronic prostatitis are more likely to have an enlarged prostate at some point in their lives. And prostatitis increases your risk of BPH. However, having prostatitis or an enlarged prostate does not increase your risk of prostate cancer. The primary cause of prostate cancer is not known. In fact, most men who were diagnosed with prostate cancer had no symptoms of prostatitis or BPH prior to their diagnosis. Thank you for watching. If you enjoyed the video, like and subscribe to the channel for more educational videos. Or visit our website at www.awesomefriend.org for more on this topic.